Finding a way to still connect with the community. BJ's Corner, Real Talk with Rodney. We're going to be talking about stress. Good afternoon, President Gerald. How are you? One of Patience Program's very own postdoctoral fellow, Jasmine Cooper. He's the sports program manager over at Parks and People.
I'm part of the Patience Program family, so I consider this a family reunion.
Dr. Richardson, thank you.
Born and raised in Baltimore, born on the east side, raised on the west side.
We need to be at the table when suggestions are made about what research comes into our community.
I recruited 25 young Black men who were violently injured.
We do not have enough people of color participating.
Figure out what people need and then try to work to make that happen.
We want to engage. This is a new pivot for us as far as socially engaging folks.
West Baltimore has health disparities like any other place.
This kind of program is doing the kind of work that we want, that your voice ought to be heard and can be heard.
It means learning what issues are important to the community.
The youth actually were planting vegetables and fruits in the garden that they themselves built over the course of the last 3 or 4 years.
I've been blessed to be working with the Patient Program for many years now, leveraging that technology and data expertise to help explore how new tools and new technologies can help us to connect with communities.
Institutional practices that are keeping resources from specific neighborhoods that look a particular way is also how racism manifests.
Here you have a zip code in West Baltimore that has a life expectancy that's comparable to the life expectancy in the poorest country in the Western Hemisphere.
One of the focuses is going to definitely have to be mental health and how that's been affected by what's been going on.
You must listen in order to learn.
A learning Peace Corps system without community members is like a team without players.
Use the knowledge to behave differently and act differently in the future.
The community members are professionals in their lived experience.
As it is going to work with research, we're going to have to figure out what parts can be done safely and properly. But that again will help us do better studies, more involved with the community.
Researchers have come to learn by way of this work that unless you're looking to engage the community authentically, that this is not the place where you want to be.
That's you having a seat at the table and improving something for you and your community.
It's been a long time coming, and I know a change is gonna come. Oh, yes, it is.